we can rebuild your breast for you.
It takes time for a woman to be confident about having a sex life again with their partner, but it is very doable.
The thing is, when you do a lumpectomy, you need to do radiotherapy, and otherwise you have to do a mastectomy. Is that right?
This episode 3 of the Breast Cancer 101 series explores types of surgeries and radiation therapy for treating breast cancer. Find out the previous episodes on Talk Health Asia's YouTube channel, and don't forget to subscribe.
Dr. Teoh, breast surgeon, how many surgery options are there?
Once you've been diagnosed with breast cancer, then we will run through with the patient to see what are the options of choices of breast surgery. Generally, there are 3. There are mainly 2: the total mastectomy, where the whole breast is removed, and there's breast conserving surgery, or what we call as lumpectomy. All right. So depending on your stage of the disease, the size of the tumor, and also the ratio to your breast, we will help you to decide what would be the best. So if you are detected, that why do we advocate early detection? Okay, because when you detect early, your size of the tumor is smaller. So if the size of the tumor is smaller, then we can offer you a breast conserving surgery, or what we call as lumpectomy, whereby we just remove the lump, right? But if, let's say, the tumor size is bigger, then sometimes if your breast size is small, then we would maybe it's better option for total mastectomy, right? In our country, in Malaysia, right, 2/3 of our patients still present in late stage, all right? So we are not having enough awareness, okay? So 2/3 of our patients are still coming with stage 2, stage 3, which means that, most of them will be offered a total mastectomy, right? So if you come with less than 2 centimeter tumor, sometimes we can offer you a lumpectomy. All right, so of course, having a mastectomy is something that most women will fear, okay, because they'll be in denial, they'll be afraid of what people will tell them, or say about them or their families, right? And so that's why sometimes, even though sometimes the women will know that they may have something that's not right, they avoid early treatment and they come late, all right? So if you have to have a mastectomy, there are options of also reconstruction or oncoplastic reconstructive surgery, whereby we may need to remove your breast because of the better cancer clearance, but at the same time, we can rebuild your breast for you. Okay, so this is called a breast reconstruction or oncoplastic surgery. Talking about lumpectomy, right? So there are several criteria or indications for us to offer you lumpectomy. That is, if the tumor size is small and if it's in relation to your breast, then we can offer you a lumpectomy. We cannot remove like half the breast, and that's called a lumpectomy. It has to be about less than 30%. If the tumor is less than 20 to 30% of your whole breast size, then we can offer you a lumpectomy, because we want to still see the normal shape of your breast. Now, if you do a lumpectomy, we need to proceed with a radiotherapy after that. We need to do a radiotherapy as well, okay? Because if you just do a lumpectomy, then the chances of the cancer coming back in the same breast, which is called local recurrence, is about 30 to 40%. So that's why you need to go for a radiotherapy, right? And by doing a lumpectomy and a radiotherapy together, you reduce the chance of the local recurrence by about 5 to 8%, right?
Okay.
So you must understand that. So if you do not want to do a radiotherapy, then the other option will be a mastectomy. With a radiotherapy, we have 2 options of radiotherapy as well. One is called external beam radiotherapy, whereby the radiotherapy is just not a one-time radiation. It is about 15 to 20 times. It means you do every day for 3 to 4 weeks. I just give an approximate. Okay, so you need to come every day for that radiotherapy session, which can be about 5 minutes like that. Okay. Yeah. So the other option of a radiotherapy is what we call as intraoperative radiotherapy, because nowadays with better modalities of radiation, all right, and we found that actually 90% of the cancer that usually recurs at the same time. That's why we can offer you intraoperative radiotherapy, whereby this means that we combine the surgery and the radiotherapy at the same time. So this is what we call a targeted intraoperative radiotherapy, whereby we deliver the radiation. That means after we will do the lumpectomy for you, right? And then before we close up the wound, we will insert the radiation probe into the room, and we will radiate the area for about 30 to 40 minutes. And then after that, then the radiation is, there will be a higher dose radiation within the breast. So it actually saves the rest of the other breast, okay, from being radiated, okay? Because why 90% of the cancer that comes back recurs usually within that same area, right? Very sporadic, whereas the other cancers that comes back around the other breast is very sporadic, it's about less than 5%. Okay, and then after that, after we have radiated, then we will close up the wound. So you only need to do it one time. Now, there are certain criteria to allow this intraoperative radiotherapy. It is not for everybody. Please remember that it's not for everybody. So we have to be selective. It is only for cases that are older age, that is more than 45 years old. If the tumor size is small, less than 3 centimeter, if it is the good prognosis, hormone positive breast cancer. If the lymph nodes are negative, if it's a grade 1 and grade 2 tumor. Okay, for these selective cases, then only we can offer you that one-time intraoperative radiotherapy.
So you're saying for HER2 and triple negative, you can't?
It is not, because those are higher risk, higher prognosis, higher risk cases. So that's why, if you want to do this, then you have to add on intraoperative radiotherapy and an external beam radiotherapy together.
I see.
Yeah. All right. So, but nowadays, there are studies to go on to show that even the boost is also equally okay for the patient as well, right?
Okay.
But for now, we'll just stick to this intraoperative radiotherapy.
Sure.
So basically, there are just two various forms of radiation therapy.
So what you're saying is, when you do a lumpectomy, you need to do radiotherapy, and otherwise you have to do a mastectomy. Is that right?
Yes, correct. Or a reconstruction.
Yes, and or with the reconstruction. Now we have some questions, and we just try to go through these questions very, very quickly. Is there a risk when you actually do a mastectomy and remove the breast?
Okay, so basically, in terms of I always tell the patient the breast has only two functions. One is to breastfeed, for breastfeeding, and the other is for cosmetic issue. It doesn't produce any other hormones that is necessary for our body.
Right.
Right. So in terms of the breast cancer risk, the surgery risk, yes, with all cancer surgery, there are risks like bleeding, infection, numbness, but these are, I suppose, acceptable risks for surgery.
Right.
It doesn't cause severe neurological stroke or deficit in that sort of form. So I'm not sure what sort of risk. Yeah.
Right. And Dr. Mastura, one of the questions that we received was, in terms of removal of breast, would there be sexual implications as well? I mean, for women in general, it is a very sensitive question. What would you say to a patient who's concerned about what it's like for the sex life?
Okay, so if they have done a mastectomy of one breast, I suppose that what we as women must know is that breast is not the only sexual organ for the sexual pleasure of a woman. So if let's say they have decided to do a reconstruction surgery, or if they decided against doing a reconstruction surgery, they can always they still have the other breast. And there are other methods where they can still be intimate with their partner, other than just focusing on that breast that has been removed. So this takes time for a woman to be confident about having a sex life again with their partner after they have had the treatment done for them. But it is very doable, and it takes the courage of that woman to actually try to have as near normal life as possible. And sex life is also one of the the health when we say lead a healthy lifestyle. So an active or a sexual life is also part of that healthy lifestyle that we advocate for the a good follow-up period after a breast cancer is diagnosed. So so my suggestion for them is actually try to think of other things that can stimulate them, can increase their sex drive. And there are also drugs that can also help you with this issue, where you can see the gynecologist in order for you to improve on this factor in your life after a mastectomy or breast reconstructive surgery has been carried out.
Right. I think that's very wise and profound, and it's all about getting creative. Back to Dr. Teoh, then I'm going through the questions very quickly. How do you treat a keloid formed on a breast surgical scar?
A keloid, Well, so far, I think there are less than 5% of patients that actually I see with keloid, but normally I suppose one is surgical techniques. We use very fine sutures to do the incisions, to close up the incisions. And after that is the care of the wound, all right? So there are scar creams that we use to help them to reduce the keloid, and I'll teach them how to massage the wound. But generally, if is generally your skin texture. If you are if you're going to get keloid, you're going to get keloid no matter what you do.
Oh no.
Okay,
Okay.
so
All right.
one of the ways that I usually check is those patients who have BCG on the arm, right?
Right.
And if those have really bad keloids, then I will just prep them and say, it may or may
It's a
not
good
happen,
indicator.
because whatever you do is going to happen. Yeah,
see.
of course, the cosmetic surgeon, the plastic surgeon will have intra-lesional injection and whatnot, but they are usually painful and having to go through many times. So if even they remove it, the keloid will still develop.
Right. And there's also the question, if they have a mastectomy, right? Does the pain and tenderness and tightness around the mastectomy area actually go away, or is it a long-term thing?
I think there will be, of course, if you go for any surgery, right, there will be some amount of pain. And, the breast is one of the most sensitive area because there are a lot of sensory nerves there, all right? And if you do a incision, if you do any surgery, definitely there will be some numbness. And because it's quite a wide area, there will be tightening, okay? Because, as the wound heals, there will be contracture, so there will be tightening. So one of the ways that I always stress to my patients post-operatively, I'll send them for regular physiotherapy for them to stretch. It's all about posture and stretching the wound properly during that important healing phase.
Right.
And doing the stretch exercise regularly. And by far or not, majority of them will overcome that. They will overcome that problem. But, if they don't do their physio, then there will be tightening and contracture can happen.
Okay. And you mentioned lymphedema earlier. Is there a way to prevent lymphedema?
Yes, lymphedema is 20% of if you go for axillary surgery, even with sentinel lymph node biopsy, you can get lymphedema because some of your nerves and your lymphatics will be disrupted during the surgery. All right. And again, scar tissue can form, and this causes the lymphatics to be blocked. All right. So that's where you get lymphedema. Right. So again, after the surgery, we will send them for physiotherapy, whereby we will teach them how to do the gentle lymphatic massage. All right, to teach them how to take care of their upper limbs so that they reduce the chance of getting lymphedema. I don't want to say that you cannot get lymphedema, because you can get it in your lifetime. Sometimes a mosquito bite, or sometimes when you're doing vigorous work, even simple things as gardening, also you can get lymphedema.
Okay.
Right? So there's a lot of understanding about how to take care of yourself. All right? And you can avoid all these things.
I was going to ask, and with chemotherapy, should it happen first or should surgery happen first?
They look at and they find that patients who have had neoadjuvant treatment followed by breast conserving surgery had better survival compared to patients that had surgery. Because we know about it, so we will put in steps in order for us to handle that side effects for patients.
Subscribe to TalkCath Asia's YouTube channel for more health chats episodes, or find easy to understand health videos on talkcathasia.com.